There was an issue with me, and so one of the nurses went and called the surgeon out of his bed.
Those regulators are not interested in how you conduct yourself with a patient.
A Health Expo held last weekend at the Queen Elizabeth II Conference Centre saw more than 80 health organisations gather in London with one main focus: to attract new customers for an array of different cosmetic procedures. Over 80% of these companies were Turkish. It's well known that many Brits go abroad for treatment, particularly to Turkey. Data from the ONS shows that 431,000 Brits left the country to receive medical treatment in 2023. Eleda Seyçer, the Vice General Manager of the Turkish ALZ group which organised the Expo, spoke about the importance of this event for Londoners.
The initial important step starts with educating the patients as well. So they don't go to the cheapest option they see. They come here, they compare their options, they learn more about the procedures, and then decide to move forward. And I also want to highlight that here, all our institutions from Turkey, they have health tourism accreditation certificates from the Ministry of Health of Turkey.
However, London practitioners, including Dr. Bessam Farjo, a hair surgeon who has a practice here on Harley Street in Marylebone, have questioned the quality of treatment that customers receive abroad, as well as the regulations that these health organisations are subject to. The average cost of a hair transplant in Turkey is £1,464, yet in the UK it's £4,820.
The people over there saying, okay, well, this is how much it is and this is how much we're going to give you, and then you're kind of shopping for a hair transplant. Those regulators are not interested in how you conduct yourself with a patient. They're more interested in certain minimum standards in running a hospital.
A professor of plastic surgery at University College London also believes that botched surgeries from abroad puts pressure on the health services in this country.
Yeah, the problem is that when they come back with complications, then of course it increases the burden on the healthcare that we have already, which is already under a huge pressure to provide services.
Despite this, Callie Dinello from southwest London received 2 treatments in Turkey in 2023 and believes that the standard of care she received there was not available in the UK.
For 4 nights and then 1 night in a hotel that was kind of attached to the hospital, just in case I needed care in between. And at 2 o'clock in the morning after the first day of surgery, there was an issue with me, and so one of the nurses went and called the surgeon out of his bed at 2 o'clock in the morning to get his advice on what to do, and I can't imagine that happening here.
Yet, it is clear that as health tourism continues to grow, Londoners will need to make sure that they're clued up on the surgeries they wish to have abroad.
So just make sure that every type of surgery you're looking at, you know exactly what is going to be needed, what your length of healing process is going to be, and make sure that you have the financial, the emotional and the physical attributes to keep you supported during that.